Something that we talked about a little bit earlier is really to make your systems as configurable as possible, to where you're not having to do these large systems changes or training changes of your staff, that you can go in, make a couple tweaks, and then the system's going to work as you need it to work for the time of the emergency. I think that's really important, because not only that configurable, but also that it can be done quickly. You're in an emergency, and the normal 90 days to get something done is not going to be acceptable. I mean, it is get it done and get it done like yesterday, because people are in need and we're in an emergency. So those are two items that I think are very important.
I think the thing that we still have to work hard at is improving our service by phone, so that people aren't waiting as long as they're waiting. And so that's the thing that we are very focused on now. I think frankly, our phone infrastructure and our technology related to our phone systems is not where it needs to be. And that's something that, if we're going to work in this model long term, we need to be able to serve people by chat. We need to have a more sophisticated IVR that we can update and change and modify to meet demands more kind of with more agility, and we just can't now with a very old system. So that's the place that I am most focused. I would say number two is on mobile. When they launched our system, a decision was made to do a customer portal that was accessible on a desktop computer and was not very mobile friendly. In hindsight, I wish the decision had been made to invest more in mobile, because we just know for our customer base that's better. Mm-hmm. And so we're going to make, small incremental progress there, but it won't be the kind of big bang and the kind of wealth of functionality that our customer portal has. And so I think that's a place we'll have to keep making investments, but that I wish we had done differently in the lead up.
I think one of the main ones for us is the rollout of an electronic healthcare record solution. While that was already planned for before the pandemic, unfortunately, it was actually a delayed rollout because of the pandemic. But it's an essential cornerstone, quite frankly, of how we deliver services. Today, literally everything is paper-based. So we have paper charts in many areas within our facilities. We've been able to successfully roll out 8 facilities on our EHR solution. We will finish that by March, and then almost immediately start talking about, so now that we have our foundation in place of providing our customers or recipients through EHR, how can we continue to improve? Because the capabilities are pretty amazing, quite frankly. Today, we have a very distributed delivery of IT solutions. I would almost say rather outdated as well. So I think with having an EHR in place, it's going to give us the capability to build upon that and actually start consolidating services in a single solution. Today, for instance, we pass information from our EHR to a payment system that probably should all be able to come out of the same payment system. We provide information from EHR probably to our community service-based organizations. They have their own EHR. Wouldn't it be nice if we all start working towards having a single EHR? So I think there's tremendous discussion now about things that probably a year ago were never even considered to be talked about. And now actually everybody is wanting to talk about it and actually doing it. And I think that's quite frankly the biggest change, is the appetite for change has rapidly increased. And I've only been with the organization for a year, but I can see in this past year, the organization is truly looking at it differently, because they now recognize that if something bad happens, such as a pandemic, you have to be able to be agile enough to change how you deliver your services. And we were not able to up to that point. And I think we are in a much better position now than we ever were before. Simple things like collaboration tools did not exist less than a year ago. So while we're sitting here on a particular WebEx or Zoom call, that didn't happen a year ago. It simply was not available in our organization. So people are starting to know the tools are there, people are using it. How can we further embrace it? So I think that's the biggest thing from my perspective. Glenn, anything you want to add?
Yeah, Robert, I think you hit it absolutely dead on in that the one thing that came out of this pandemic, if anything that was positive, is that we uncovered a lot of things that were underlying that we should have been addressing at some point in time that we didn't have attention on because we didn't have the need to have that attention. And as we moved into the pandemic, those things were uncovered and very quickly became extremely important. And as Robert alluded to, the appetite now for change, especially in the IT space, and the acceptance of that change is greatly, I almost said improved, has greatly increased over time because of being able to grasp onto these new technologies and move forward. Case in point is soon after we went into the teleworking environment, we immediately started a working group of, when this is over, how are we going to bring everybody back in? And then it became extremely apparent that why should we bring everybody back in? And those questions were answered in that we don't have to do that. We can be very effective in this teleworking environment. I think the key to all this is like what Robert had brought up, was the collaboration piece, and all these tool sets we now have to collaborate together and come up with not just an idea, but an actual strategy of going forward. In the past, especially with our agency, and as Robert had mentioned, he's only been with the agency for a year. I came on board in February and immediately went into COVID response. But something that we found in very early stages is we had a need to communicate amongst other agency entities, and ours, we didn't have a common platform to do that in. There was an offering for that, but for us, it was not a viable option because it wasn't HIPAA compliant. So now as we go through and we start looking at solutions, especially solutions that are offered to us by our state agency, VITA, we have these questions now. Well, is it HIPAA compliant? And they understand that now. So as they roll out solutions, it's something they're looking at as making sure that it's HIPAA compliant so that all agencies can utilize that, as opposed to what was in the past.